You can't change the pace at which the world is going.
So, doctor, can stress cause irregular periods?
Stress can affect in any which way. What you can only change is yourself to cope up with the whole lot of things.
From irregular periods to painful cramps, stress plays a bigger role in your menstrual health. To help you understand your menstrual cycle, we have Dr. Rajeshwari Pawar, an obstetrician and gynaecologist at Cloud9 Hospital, Kalyani Nagar, Pune. Welcome, doctor, in today's episode.
Thank you. Thank you for having me.
So, doctor, can stress cause irregular periods?
Yes, very likely, very possible. And these days we are seeing a lot of it because we have patients who have been, or moms, I could say, or women working for 8 hours, 10 hours, 12 hours. Sometimes they carry work home. So it has impacted. We've done so many investigations and it all turns out well. And then when we ask, are you really worked up? You're not able to give time for yourself? And then the real cause for the irregular periods comes out.
Can stress make periods heavier or lighter?
Let's put it like this. I would like to give you a little bit of background information as to how stress causes. There's a structure called hypothalamus in the center of the brain that deals with all the emotions, but it also deals with all the regulatory mechanisms of the body, which means hunger, hormone release, sleep cycle, the whole lot of things. Whenever there is stress and it is impacted, it sort of regulates and dictates how the hormones should be released.
So, doctor, does stress affect periods pain?
Each woman has her own individual pain threshold, right? We have seen mothers who are very apprehensive of delivery, labor pains, and they just go beautifully well without even requiring a pain relief. At the same time, we have had others who are not really scared, but when it really comes to the labor pains, or they are they are just unable to tolerate it. So there's something called an individual pain threshold. Apart from this, whenever we are affected, sad, anxious, fear, then it somehow expresses in different ways. And we've seen dysmenorrhea, or the pain during periods, is much more when a person is more anxious or feeling low and all.
So, does stress cause spotting between periods?
If the hormones are going to affect the ovarian cycle and the whole menstrual cycle, it can affect in any which ways. Delayed, sometimes intermenstrual bleeding, sometimes spotting. But I would like to take this opportunity to tell you, whenever there's a bit of spotting in between periods, then definitely you need to go to the doctor and have a consult, and they would have a look to make sure that the spotting is not due to something else, which can be more sinister.
So, does stress worsen PMS symptoms?
As I told you, the pain threshold, the moods, all are especially the premenstrual syndrome, the PMS, is all related, very much related to our emotional centers. And we have seen premenstrual syndromes or the PMS symptoms getting worsened when people are stressed.
Okay, so doctor, how can one manage stress to regulate their periods?
You can't change the pace at which the world is going. You can't change your traffic. You can't change your workload. What you can only change is yourself to cope up with the whole lot of things. For different people, it could be different ways to release the stress. For somebody, it could be, sit quietly, look at the sky, look at the greenery. I've heard someone saying, I have to run 8 kilometers every day, only then I'm calm. For somebody, it could be watching Instagram, maybe relaxing. So, or saying a little prayer, or deep breathing. Just when you're feeling stressed and your thoughts are just racing, that minute, get a little conscious, step back, concentrate on your breathing for the next 1 minute or 2, and see the enormous difference that it makes.
Okay, so one last question. When should one see a doctor?
Definitely you should see a doctor. before things really get worsen. And as I told you, first we do a total workup to make sure that it's not something else which is causing these whole lot of things. And based on what exactly is the causative factor, then we take it accordingly.
It was great having you here. Thank you so much for your time.
Thank you. Thank you.
And to our listeners, if you found this episode informative and helpful, do share it ahead and subscribe to our channel for more such informative videos. Until then, take care and stay healthy.